Myxomatous and mitral valve diseases in dogs. The occurrence. Myxomatous valve diseases in dogs are the most common cardiac diseases in dogs. They consist of 2/3 of all canine cardiac patients. It affects 3.5% of all dogs. The likelihood increases with age, and small dog breeds it occurs more often, and males it affects more often than females. It occurs as a degenerative process within the AV valves. It's caused by changes of the valvular interstitial cells into another phenotype that produces smooth muscle cells and ECM. And this compromises the structural components of the valve leaflets, the mitral valve leaflets. Myxomatous mitral valve diseases in dogs are associated with higher levels of serotonin and increased expression of serotonin receptors. The pathology is there's an expansion of ECM with glycosaminoglycans and proteoglycans. The valvular interstitial cell alteration means there's an attenuation or loss of the collagen-lated fibrosa layer. These lead to a malformation of the mitral apparatus. The thickening of the valve leaflets at distorted edges of the leaflets, known as knotting or myxomatous degeneration. There's a dilated mitral ring, like an annulus, and the valves won't close properly. Maybe some prolapse of the valves backwards. The clinical consequences are mitral valve prolapse, mitral insufficiency, and left atrium and left ventricle dilation, the volume overload, and eccentric ventricular hypertrophy. The dilated chambers mean there's a dilated mitral valve. The dilation of the left atrium is a key feature of myxomatous mitral valve diseases. A normal left atrium to aorta ratio is 1:1. A bad is 1.5:1, and a severely bad is 2.4:1. This is severely advanced left atrium dilation. The increased left atrium dilation is caused by an overload, which causes pulmonary vein pressure, which can lead to pulmonary edema. Pulmonary hypertension is seen in advanced cases of chronic myxomatous mitral valve diseases. For the diagnosis, do a normal physical examination. The punctum maxima of the mitral valve is between the third and fifth intercostal space. You should hear a systolic heart murmur, the left apical, and there will be signs of left-sided heart failure. On the radiograph, the cardiac chamber is enlarged and there are signs of lung edema. A large heart, a murmur, and infiltrated caudal lung lobes are all symptoms of pulmonary edema. The ACVIM guidelines on chronic valvular diseases in dogs, so A is patients with high risk but no identifiable structure disorders such as small breeds. B1 is asymptomatic patients. There's no evidence of cardiac remodeling, like a normal sized heart is present. B2 is asymptomatic patients with cardiac remodeling. There's a dilated left atrium or left ventricle, but no pulmonary edema. C is past or current clinical signs of heart failure associated with structural heart disease. And D, the patients with end-stage disease with clinical signs such as respiratory, refractory, or standard therapy. Patients in C and D have respiratory problems, such as dyspnea and tachypnea, due to pulmonary edema of the pulmonary tension. So the treatment of asymptomatic myxomatous mitral valve disease in category B1 and B2, so when you basically find the murmur, you give pimobendan. It's a vasodilator with a positive ionotropic drug. It's both a calcium sensitizer and a phosphodiesterase inhibitor. For patients in category C and D, this is a congestive heart failure stage already. So typical treatments would be furosemide, which is a loop diuretic, and pimobendan, which is a calcium sensitizer and a PDE inhibitor. The complications of this disease are pulmonary hypertension, arrhythmias, and left atrial tear. The rupture is due to the high pressure in the left atrium.